what the lymphatic system does is it literally takes out the trash. I think everyone should care about the lymphatic system because you actually have twice as much lymph tissue and fluid in your body than you have blood. So if there's that much fluid, we need to know what it is, what it's made of, and what its role is in our body. It plays a significant role in our body. It plays a significant role in our health every day. If you don't have your health, what do you have?
You are a functional medicine doctor.
Join us as we blend modern and ancient wisdoms to be well now.
Well, I'm a curious patient of yours. My name is Nick. You're Dr. Ron Dummar.
Yeah, absolutely. I've been practicing here for 15 years now, and it's been excellent every day. We have a lot of great every day. Saturday and Sunday are the best. I do sometimes come in on Saturdays and Sundays. I prefer not to, so if we can keep that on a minimum, that would be great. But yes, I am here. I'm available to help people, and that's one of the reasons we're doing this podcast, is to be able to reach out to as many people as possible to provide for them the healing techniques and benefits that we offer here in the clinic.
Well, this is the Be Well Now podcast. Thank you for listening. If you're watching on YouTube, please subscribe. And if you don't know why, we'll earn it for you. We're going to provide lots of great information. We talked about the lymphatic system, and I said, why should I care? Make this interesting for me. Not that it's not crucially important to our health, but I'm wondering the why, right? So give me a sense of like why I should care about the lymphatic system.
Well, I'll ask a simple question and maybe give you an analogy here, something to equate it to. Why do we in our communities care about garbage trucks and proper disposal of trash? It's a very, very important thing that occurs in our communities, and we participate, every single one of us participate every single day of our lives in the proper disposal of trash. If we allow that to accumulate within our own homes, it becomes very, very problematic to our own personal health very quickly. And so what the lymphatic system does is it literally takes out the trash. It goes around our entire body. It has macrophages, especially these little areas called lymph nodes. A lot of people, you can go in and you can palpate in and around your neck or around your legs or different areas, and you'll feel a little bump, and that's a lymph node. It's an area where you have a higher concentration of lymphatic tissue. You have a higher concentration of white blood cells, macrophages, and immune cells that are going to fight off pathogenic factors. So when these immune cells actually find or detect some of the trash or pathogenic factors or debris that's in the body and not serving the cell itself, it pulls it first right to the lymphatic system, and then as it moves through the tubes of the lymphatic system and gets to a nodule, it'll have an opportunity to be completely consumed and broken down if it's considered to be a threat to the body.
Okay. Tell me more.
Oh, absolutely. So one of the cool things that a lot of people don't realize is that, lots of people have had their appendix removed. And the appendix is actually an organ, or it's attached. It's part of the lymphatic system. One of the roles of the appendix is to maintain the appropriate flora for the gut and the GI. And if you have, say, a flu, or if you have some sort of condition that you eliminate very quickly the contents of the bowel, you're also eliminating all of that nice bacteria and flora, and you have to regrow that. Well, the appendix plays a significant role in actually maintaining the proper health and hygiene within the gut and the GI. And it's part of the lymphatic system.
Okay.
Right?
I didn't know that.
That's pretty cool. The other thing is that the lymphatic system, you'll understand from some of the techniques that we give to you and recommendations, suggestions, but the lymphatic system relies entirely. It doesn't have a heart, right? It doesn't have anything pumping it. The fluid, you have more fluid in your lymphatic system than you have blood, and you have tubules, and you have links to different organs and organ systems, like the spleen is an important role. It plays an important role as well in the lymph system and in immunity, but we don't have anything to pump the fluid through. So there's got to be things that we do in our daily lives to encourage the movement of this lymphatic tissue, the fluid specifically. Those things that help with the lymph fluid movement are gravity. So, You look at kids' activities like spinning on, doing somersaults, going on the merry-go-rounds, the different activities that they participate in on slides and at parks. All of those activities actually encourage lymph movement. And that's based on gravity. All of those things are.
Do trampolines help?
Trampolines do help. Yeah. Little rebounders are very good for lymphatic movement. Breathing, doing breath work and breath exercises, lymphatic attachments in and around the diaphragm. You actually have more lymphatic attachments in the abdomen area, and especially specifically to the gut and the GI, than anywhere else in the body. So breathing, expanding the abdomen, contracting the diaphragm, pulling in and out the lungs. It's so beneficial. And then the last one really is movement. Movement and activity. Those are the three main ways that if you can practice those in any degree, you will help and speed up the trash collection and elimination process in your body. So people run around saying, I want to detox. I have to detox. I need to detox. Well, the lymphatic system is like a major detoxification organ. So if you want to detox, those are the three things to especially pay attention to that you're doing every day to support the detoxification organ.
Breathing.
Movement and gravity, so like changing, putting your head below your feet if you can. For some people, depending on age and health status, you're not able to do those things, and that's fine. But thinking about gravity would be like the playground, the activities on a playground, and then breathing, breath work, and then movement, like exercise, running, walking, or even like a whole body vibration unit. Okay.
So give us some strategies then for promoting lymphatic health.
Yeah, well, one of the things is to make sure you stay hydrated, because if you lose hydration or start dipping in the hydration, then the lymph tissue or the lymph fluid itself can become more congealing and more viscous. And if it becomes more viscous, it's harder. I mean, imagine squeezing molasses through a rag as opposed to just regular water. It's a lot harder to push that through the pores of the rag, right? Whereas if you have a very well managed viscosity or of the fluid of the lymphatic system, it's going to be able to be encouraged to be moving through a lot easier. And the way we do that is with proper hydration. One of the things that we're offering at our office, or that we provide at our office, is IV treatment and therapy for patients. So many patients go around for a large portion of their weeks and even months, and they're dehydrated. Sometimes mothers, I would say expecting mothers, find themselves in situations where they're extremely dehydrated, and they start developing a variety of symptoms, or even having early cramping symptoms. And by simply getting a better hydrated, it improves that for them.
That's such a big deal.
Hydration is a big deal. Also, detoxification in general, like encouraging the detoxification organs. We've talked about this on other podcasts. Detoxification organs, so respiration, perspiration, and defecation and urination. So you need to be able to support the urinary flow, the fluid flowing in and out of your body that helps support the detoxification. Defecation, so you need to make sure that the bowels and the gut are moving appropriately as well. You want to have at least 1 to 3 snakes a day. Okay, that's an important tool. If you're having more than 3 and it's excessive, then it's likely you have some sort of gut dysbiosis or inflammatory bowel disease. And you can check with us on that, and we can help you determine how to best treat that. Or if you're having fewer than 1 a day, there's also an issue that needs to be addressed there. So those detoxification pathways are super important. Obviously, sweating, perspiration being one of them that allows us to open up the pores and allows the lymphatic system as well to begin to eliminate some of the fluid that it might otherwise be holding on to. Another thing that the lymphatic system is really responsible for in the body is managing the extracellular, intracellular, or the interstitial fluid itself. So like the fluid that moves into the legs, you could say, or arms and out into the pores, versus the fluid that is found and contained within the lymphatic system itself and within the blood. So one of its main roles is making sure that the balance of fluid throughout the different matrices of the body is appropriate. And so if we start developing swelling in our ankles or swelling in our hands, this is a lymphatic issue, or it's something that can be benefited by supporting the lymph system.
How do you know if it's like a lymph issue? That's what I'm wondering.
If it's swelling.
Okay.
I mean, if it's swelling, there's need to encourage the lymphatic system, to support the lymphatic system.
Really?
Yeah. So obviously if there's swelling, it could be an injury, right? It could be a sprain. It could be a damaged tissue of some sort, right? That's needing repair. But it is the role of the lymph system to manage the swelling and manage the fluid within the body appropriately so that the swelling doesn't remain there for long periods of time.
Okay. What about food to encourage detoxification?
So foods that you would want to encourage or to utilize are things like antioxidants, fiber, even just consuming fiber that helps with the bowel. But I really like to do leafy greens, berries, nuts. All of those type of things can help with neutralizing the problems that may occur if the lymphatic system is stagnant. Also, like, you want to eliminate, I would say, if you can, possibly eliminate processed foods. Processed foods have a way of stagnating the lymph system and also causing or leading to a viscosity of the fluid that is much thicker than it should be.
So we could talk about all the different things in tap water and the environment and everything, but the number one place to start, I think, for health, it just seems like I could be wrong, but just is eliminating processed foods.
Oh my gosh.
Is that just like a distilling?
If you just say, hey, let's eliminate processed foods. To be honest, I could be a really lazy doctor and just say, hey, eliminate processed foods if you want to heal. I mean, in our culture, that's one of the best things that you can do for your health, is to attempt to consume as many things as possible from farm to table, and to minimize as much as possible the things that you're eating out of a package. If it has a label, beware.
Even if it's nuts?
Even if it's nuts. Or read the label and see what's in it. If it says walnuts, well, that's great.
Okay, cool.
Or if you look at it and the label says walnuts plus sodium ascorbate plus PE40, red 40 and dye, or it has like excess amounts of sodium and salt, and all of a sudden you've got like 7 ingredients on that ingredients list, and yet you just bought a bag of walnuts. That's a problem.
So as much as we can minimize that. What about chocolate?
Oh man, what about, so chocolate generally, like chocolate, cheese, dairy, they are generally stagnating foods. People love chocolate, absolutely love chocolate. Chocolate's been a cultural treat, I think, that was sourced in Africa. It's actually an African bean from the 1800s, maybe even the 1700s. We've been sourcing this delicacy and turning it into a morning cup of, a morning cuppa, I think is how they say it, right? And so we've been doing that for a long, long time. It does have caffeine in it, a little bit of caffeine, not a lot. But there are dark chocolate varieties that we generally recommend because they're high in antioxidant. The bean itself, it's a plant. It's a naturally occurring substance. So we want to highlight its beneficent qualities. And some of those are the rich antioxidants that it does carry. So can dark chocolate, having a nice treat of dark chocolate, be a good thing? Yes. Can utilization of chocolate be is it a possibility? Yes, it is.
Like anything.
So yes, deep breathing. We talked about breathing.
I think we've talked about it, but I don't know what you're talking about. So let's talk about it today.
Yeah. So I think, breathing, one of the things that breathing does is, it expands your rib cage as well. It opens the thoracic cage. So where your ribs are, you take a nice deep breath, and it simply even just mechanically opens the rib cage. Well, you have lymphatic chains all the way around in between your ribs. So between each of them, you have a little lymph chain that moves through each of them. And so by opening and expanding, it creates a little more tension on that lymph chain, and then compressing, right? It reduces it, and then it extends it again, and then it reduces it. And so by simply doing nice deep breath work, opening and contracting the thoracic cage, that's going to help move lymphatic tissue through. It's also incredibly stress relieving, right? Like getting air, actually having oxygen fill the molecules of the brain, and you're able to concentrate better, think better, make better decisions, and you have a lot less stress, right? You can function better under pressure. And so why not try incorporating a few minutes of deep breathing into your everyday routine? It's a great idea. It's super good for your health, and it's actually going to benefit your body in eliminating pathogenic factors and toxins that you otherwise would not want.
Is there a deep breathing exercise that you recommend?
Oh, I recommend 2 of them generally in my office. So I like to breathe in nice and slow all the way to the top, and then breathing out. And these are in through the nose and out through the nose, breathing out through the nose all the way out. And then you continue to see how long and controlled you can be, and slow and steady in your breath. In and out. One of my colleagues at school, we had a competition, and we would talk with each other about the importance of breathing and stilling our heart rate and our heart rhythm and reducing our blood pressure. And we believed that we can do that. And of course, research shows that you can as well with breath work. And so what we would do is we would have little competitions with each other to see who could sustain the inhale the longest. And so we would practice inhaling for as long as we possibly can, and then practice exhaling for as long as we possibly can. Now, if you really get serious like we did about that, you inhale, and by the time you inhale, you're at a point where you've worked so hard, you're like, I got to take a few more breaths, right? And that's okay. So we're really just working on a skill set. Okay. And then the same thing out. Now, so nice rhythmic breathing so that it's all controlled all the way up and then all the way down. Okay. And then if you want to challenge yourself, sustain that breath as long as you can, the inhale, and then likewise challenge yourself on the exhale. Now, the last one is called fire breathing. It's where you stick out your tongue a little bit like a dog and you pant. And you're going to pant 5 times. And then you're going to do a big inhale and a big exhale. And then you're going to pant again 5 times. And then you're going to go inhale and exhale. Ready?
Yeah.
Okay, here we go. One more time. There you go. Did you feel that in your brain? Boy, that improves the excitatory mechanism to the brain. It flows, the blood's flowing in my brain, oxygen's in my brain. I'm ready to go for another 30 minutes here.
That was interesting for sure.
Yeah. But you felt that kind of surge, right? Where you almost went, so that's the surging of the blood flow, the increased oxygenation gets into the brain. The fluid moves in and out of the 4th ventricle in the brain. And so things are happening at a really good rate. And so that's a great thing to be doing. Deep breathing. Don't forget to breathe if you want to have good lymphatic health. Whole body vibration is a great one.
Maybe I could...
You've been on the machine, right?
No, but why don't you talk about it, and then we can record some video of it to cover it. So yeah.
Okay, yeah.
So tell me what we're watching. Tell me about whole body vibration here.
Yeah, so whole body vibration, you can see that the plate itself is wobbling back and forth. Some of them have a variety of different patterns, H patterns as far as their vibration as well. But essentially what we're doing is we're eliciting a contraction, a rapid contraction within the tensile deep fibers of the muscles and the tendons themselves. So this can actually increase flexibility, but the fact that we're contracting rapidly those muscles, we're putting stress as well or compression on the lymphatic system. So because we're putting stress on the lymphatic system or compressing it a little bit, we're pushing and moving that fluid through the lymphatic system. Now, it's a one-way street. Lymphatic system, it doesn't just like go back and forth. It's constantly moving towards the exit. It's always trying to clear and eliminate and detoxify. So it doesn't really have valves like the veins do, but it's a one-way street in that the fluid really is encouraged to move just one way. Now, if it starts to pool and it does reverse, that's when we have the ankle swelling, feet swelling, legs can swell, and sometimes you can even push down in the leg and you can see this pitting edema where you push your finger onto the leg and it has a divot and it stays. So with this machine, what we do is we use it to help with the lymph system. We also use it to improve flexibility and muscle function. But studies have suggested that whole body vibration can aid in reducing the lymphatic congestion, and it actually improves your immune function for the reasons we've talked about before, right? That if you can get this fluid moving through and if you can clear pathogenic factors and debris out of the cell, so it's going to help every single cell in the body to actually clear its contents, detoxify, and push that into the lymph fluid. And then as we start moving that through, if the pathogen happens to be in there and it gets to a node, it's very likely you're going to have a swollen lymph node, right? Or it's going to start to swell or cause a little bit of pain. Now, last week, we were not able to get together to do this because I was out a little bit. I had an infection, and I did have a lymph node swell just on my neck, my lymph chain on my neck. And so it had swollen and got quite large, actually. And so I did a variety of these techniques and massaged it and kept my hydration up and my mineralization. I took some detoxification herbs that we have here. We can talk about some of these herbs as well. But these herbs really help with assisting the body to neutralize toxins and pathogens. So I did all those things, and essentially by the next day I was feeling pretty good, still slightly swollen and tender for sure. I'd say it took probably 3 or 4 days for the tenderness, majority of the tenderness to go away. But it wasn't really bothering me. The majority of the swelling went down right after that day. So.
And then you also have a lymphatic massage here.
Oh my gosh, yes. Everyone needs to get a lymphatic massage.
I think
if you are in the local area, you should call in right now and schedule a lymphatic massage. It is fantastic. She does a phenomenal job. And our massage therapist, this is something she has studied intensively and solely for the past 5 years. Okay, so she's a massage therapist, obviously, but she has dedicated her work and her life to lymphatic massage. We're going to have her on in one of our upcoming episodes, but she's very passionate about it. She loves to talk about how she wants to teach mothers to train. She wants to teach mothers and train mothers to be able to help do massage techniques on their children for when they have different illnesses or things that they can benefit from the massage. So she's very, very focused, wants to help, is a fantastic individual and has a lot of knowledge on the lymph system and kind of unique ways of addressing lymph issues.
Well, maybe we can chat more with her about that. I know one last thing that and I'm looking forward to that, by the way. There's this condition called lymphedema.
Yeah, lymphedema.
Yeah.
So lymphedema is...
How did I know that?
Yeah,
it was on the notes.
How did you know that? Seriously, Nick,
this.
That's pretty good. Well, we've talked a little bit about...
Without an outline, we tend to meander off into the woods.
Yeah.
So it's not like you don't know what you're talking about, but this keeps us on track.
Absolutely.
If you're watching on YouTube, which I hope you are, subscribe to the channel. Show some love.
Probably kept things a little bit more organized and systematized in people's brains, I guess, as we've been talking, right? That we're flowing from one subject to the next and they kind of build on each other.
Yep.
And lymphedema, it essentially is caused by some sort of issue to the lymph system. That's really it. If there's some sort of breakdown or disruption in the lymph system, then lymphedema can initiate. So it could be cancer treatment can actually cause a problem with lymph. And so if you are undergoing cancer therapies or cancer treatments, the lymph massage is a really good tool for you. Things like surgery, radiation, all of these things can interrupt or disrupt or even sometimes remove, like these surgeries are sometimes removing lymph nodes from the patients. And so we have to really make sure if you have received any of these type of surgeries or conditions that we're giving you the proper support to keep that lymph fluid moving at the right viscosity, but also to keep it moving and eliminating through the proper channels. Infections, severe infections can lead to lymph node inflammation and scarring. We talked about that, but what that can do, especially if you have a really severe infection, like I said, I had a lymph node actually swelled. It wasn't so noticeable, it wasn't so swollen in mine that people would like say, oh my gosh, you have mumps or something like that. They almost didn't really notice it. I had to like tuck my chin to show the discrepancy from side to side for my wife. And then she was like, oh my gosh, yeah, I see it. And I had her palpate it. And then she's like, okay, that's enough. I don't need any more proof.
Yeah.
Right. And so, but a severe infection in one of those nodes can lead to scarring, because if you have inflammation, you can get scarring, and the scarring can impede the flow of the fluid. And if you impede the flow of the fluid through that lymph chain, then it results in building up of fluid, or the inability of the lymph to be able to properly distribute and assess the fluid in the body in that area that is controlled by that lymph chain. Therefore, you can develop swelling, lymphedema.
I want to get a lymphatic massage now.
Yeah, you should, dude. You should go get it.
I think I'm going to do it before the...
Did I do my job? I did my job. I got you. You feel motivated?
No, I feel like very fired up about this.
There you go.
I suppose if folks have listened this long, maybe they have lymphedema, some natural ways to manage it.
Oh, that's a really good question, actually. I love to manage things naturally.
Oh, really?
Right? Yeah. So I'm kind of like the natural.
Just take a drug from Walgreens kind of guy?
Natural kind of king. I like to do that.
You're the king?
Yeah, the king of natural. That's what I like to do, And so
you called yourself that too. It's not like someone else did. So that's glad you did that.
It's what I like to do.
The king of
So, okay, fine. Now moving beyond that. Here's the deal with lymphedema. Okay, there's a variety of different things that you can do to help with that.
I've never even heard of this.
One thing that you can do, and a lot of people are familiar with it. A lot of people who run like to use this garment, you could call it, but it's a compression garment, right? Or you can use a compression sleeve or compression sock. And if you're struggling to distribute the fluid in the body, these oftentimes will at least help to prevent it from pooling throughout the day, as gravity, if the lymph system is weakened or compromised, gravity is going to push all the fluid down, right? And so, again, we've talked about a variety of different things that you could do, right? But one of the things that you can do to prevent it is actually close the space. So you close the space by wearing a compression garment, and it's not going to allow the fluid to pool in there. Another thing you can do is exercise. Gentle exercise, walking. Doesn't have to be anything super severe like Nick, muscle guy over here, bodybuilder, we know, right?
Yeah, right.
Oh, no? Okay.
I
but
walk.
you love to run, right?
You know what? The body's breaking down. I just walk.
Okay. And that's all you need.
I'm humbly accepting my body breaking down. So the long walks are good for me these days.
Absolutely. I had a patient today, brought in their whole family. We do family care. It's the first Thursday of every month is a family day. We like to treat families as a whole, from all the way from the dad down to the babies. We treat everybody in the family. And so they came in and they were talking to me about how they have started walking. Like his work has generally just kept him in a chair and an office desk, and they started walking. And they loved it so much, they increased the amount that they walked. And he's like, now we try to walk 8 to 10 miles a day.
What?
They're walking 8 to 10 miles a day. And they love it. They're excited. And the kids are excited about it too. And mom was like, well, yeah, I love it because of the health, and it's so good. And I get to talk to him, and we get to, communicate. And it's been such a great thing, not only just for his health, but it's been a really good thing for their relationship too. So walking is good in so many different ways. Also diet, nutrition. You want to, again, what did we talk about? Processed foods.
Yeah.
Sodium, you want to have low sodium. A lot of processed foods are very high in salt, very high in sodium. If you are using salt or adding it yourself, make sure you have a Celtic sea salt, a mineral salt that has a variety of different minerals and things in there too. Foods that are also good for anti-inflammation, things like ginger with gingerols, turmeric, Turmeric's very beneficial also. And then tea, like herbal teas. Come pick up some herbal teas from us. We have lots of great herbal teas that can help in a variety of different ways, from swollen glands in the throat and mouth, all the way down to the stomach, the foot, gout, all sorts of things we can help you with. And these can all be beneficial to the lymphatic system.
Elevation and rest. What's that all about?
Elevation and rest. So elevation elevation is also a reference to what we talked about before with the, when you think about the park, right? The kids in a park where they're changing gravity, they're working with gravity in a way to stimulate lymphatics. So elevation really is lifting your feet, right? So you lift your feet. If your feet are swollen and you have lymphedema and you lift your feet for a period of time, that fluid should all start flowing back to the heart. Because just as it flowed down with gravity, now you lift them up, well, gravity is going to push them the other way, which is towards the heart, towards the GI, and into elimination, so that the legs and the feet will not be nearly as swelled. And our last one that we love so much, mind-body. Mind-body practices like meditation, yoga, Tai Chi. These are all such good things. I would highly recommend Tai Chi if anyone has not done Tai Chi. The very slow motions and movements of the body, being in full control, eliciting contraction of the muscles and tendons in a different way that is unique than we otherwise would, elicits the promotion of lymphatic flow. And so I like to recommend with Tai Chi, going off maybe on a little bit of a tangent here, but I love to recommend that you just let's take 3 activities that you do generally throughout the day: going up the stairs, getting up from a couch or a chair, and give me another activity.
Walking to my car.
Walking to your car. Okay, great. You might never get to your car in this activity, but all right. So the idea is you take that activity and you slow it down into as many micro pieces as you feel like you can. So with the steps, if you go to the stairs, you look at the stairs, you shift your weight, you very slightly lift that leg up. All your weight's on one foot. You're reaching up into the next step. You place that leg down on the step as very softly and gently as you can. And then you put it from heel to midfoot. And then you start applying pressure to that foot and shifting your weight and pressure, and then releasing the pressure from the back foot, but not taking it off the floor yet. And then finally bringing that rear leg up until you match that next leg. Okay, so things like that, you want to really just break it down micro. And that itself can be a really good exercise for the lymph, but also it's so good for the stabilization of the joints and the muscles themselves. So we hope that you have learned something today about your lymphatic system and how important it is in your health, and that you take steps literally every day in your life to being well now.
You nailed the landing there.
Well, that was pretty good, wasn't it?
That was good.
Yeah. It came out kind of all right.
You're like poetry. Mm-hmm. I'm pretty good at this. Namaste, everybody.
Namaste.